Welcome, viewers, to Morning Grounds, Morning Rounds. This is our series at Stony Brook Medicine where we talk to key leaders about initiatives that are important, about institutional projects, and about what people really are looking for as their goals as they do their work to move Stony Brook Medicine forward. Today we have with us Dr. Imo Aisiku, who's the chair of the Department of Emergency Medicine. We're thrilled to have you with us today. And we're looking forward to hearing a little bit about some of your ideas about the Department of Emergency Medicine, where we can go, and maybe a little bit about what brought you to Stony Brook.
Absolutely. Thank you for having me on the show, Bill. And it's a pleasure to be here, and looking forward to discussing some of that with you.
Great. Well, first of all, welcome to Stony Brook, and I hope you've had a warm welcome since you arrived in October.
It's 3 months.
August. Okay.
August.
Great.
And I've certainly had a warm welcome. I grew up in Brooklyn, but this is my first time in Long Island. And I have to tell you, everybody's just been amazingly warm and receptive. So my family and I are pleased.
Good. I'm delighted. Well, welcome back to the New York area. Tell us a little bit about what your career path is, what interested you in emergency medicine, and sort of how did you get to where you are?
Certainly. So strangely enough, as a medical student, I was headed down the surgery pathway almost till my fourth year. And then had an epiphany of really liking the critical care parts of surgery and the sort of day-to-day variability of emergency medicine coupled with the procedural aspect. And so I changed my mind in my fourth year and ended up matching in emergency medicine, and I've loved it ever since. And as a result of combining the two things, I subspecialized in critical care and neurocritical care, and have enjoyed bringing the two disciplines together as it's a new discipline.
Great. That seems like there's not a lot of people who do neurocritical care and emergency medicine. It must have been a good way for you to advance your career in academics.
It was. One of the really great things about it is it gave me the opportunity to interact from the inpatient and outpatient side, see critically ill patients come into the department and get to follow them a little bit longitudinally, but through the critical aspects of their care before they went to the floor. I think the number of people who are trained in that is not that many in the country, but we certainly are a growing aspect of emergency medicine, which is what I think makes it exciting for anyone who's considering emergency medicine.
Good. Okay. And I'm sure there are a lot who are. So now you're Stony Brook as chair of the department. What do you see some of the direction for the Department of Emergency Medicine going forward to advance the field and advance Stony Brook?
Well, first let me tell you, a lot of what I would call, life may sometimes just set a path for you. And the opportunity to apply for this position came at just the perfect time.
For us too, by the way.
Thank you. I played different roles there in Boston. And here, what I first noticed is one, closer to my family in Brooklyn, closer to my parents in Richmond, as well as looking at a department that really had a strong foundation, a 30-year departmental history, 48 residents, 100,000 volume emergency department. And when I walked through and visited, just an amazing clinical operations perspective. And so from my perspective, after practicing in emergency medicine for the 20 plus years and looking at different aspects, having a role in faculty development, having a role in research, having a role in developing educational programs, this seemed like a perfect opportunity to take like anything else, whether it's a house or your education. If you have a strong foundation, then building from there. And that's what attracted me to Stony Brook. My first visit here, I saw the campus. I just thought it was beautiful. And that sealed the deal as far as wanting to be here at Stony Brook.
Right.
Now, for emergency medicine in particular, this is an academic institution that one of the first things that really struck out to me was that Stony Brook in general, especially the School of Medicine, was embarking on a growth process. And certainly in my research, I sort of noticed, I'd say in the past 5 or 6 years, if I'm correct, that there just seems to be a lot more momentum in that sense. The expansion to a system model, things of that nature, the integration between the medical school, the undergraduate campus, and so forth. And I have this strong belief that the emergency department has this unique space where, being the front door to the hospital, we get to serve our patients in that way, while as a part of the medical school, we have to focus on the teaching, the academic, and the research aspects. So from my vision here is, we've got a great clinical operations, and I hope to bring a vision that strengthens the academic, the research. The teaching is strong, but then integrate them in such a way where I want people to think of Stony Brook not just as a regional powerhouse, but in the next 5 to 10 years, think of Stony Brook being a global powerhouse in all of those areas, not just nationally.
I like that. What do you think you would do that would drive us in that direction?
Certainly. So some of the things that my first 90 days, so to speak, was, in all honesty, I've listened. I've listened to my faculty. I've listened to the nursing staff. I've listened to key leaders on the hospital and School of Medicine side to really sort of get a sense of the culture. I have a very strong belief that it's not for me to bring my previous culture to Stony Brook, right? But to learn Stony Brook and then see where I can add value, so to speak. And so what I've learned here is that I think we have really strong opportunities on the research side of the fence. And I'm putting together an infrastructure that'll help lead us to, my goal is over the next 5 years to be one of the top 10 emergency departments in research. I think from an administrative and teaching perspective, not only to be a good clinical operations training program, but one that also produces leaders across the country. So really giving them faculty development centered around leadership, giving them self-specialty training so that when we look back at our alumni, they're not only leading within our university, but they're leading across the country and helping us set pathways. And then if you think of all of those things, being innovative about it, and so the organization of our emergency department, the resourcing of our emergency department, how we interface with the different departments, because the strong part is, for someone who's in critical care and emergency medicine, we have to collaborate.
Sure.
The strong part of this is really having a sense of collaboration amongst the department and the different schools of medicine. And that's my kind of 10,000-foot view of how to get us there.
So two things that you brought up that I want to tie back in. One is collaboration and one is leadership. So, of course, the emergency room is a very high-stress environment. So how do you teach those skills of leadership, and how do you feel the best way to collaborate is with other departments in that high-stakes situation that is emergency medicine?
Yeah. I'll tell you, first I'll speak to the collaboration side. When I met with all my faculty, I gave them an analogy from up through medical school. I earned a black belt in martial arts and was really into Bruce Lee's martial arts. And one of the key components of it was, if I'm a black belt and you're a black belt, and I'm trying to teach you or vice versa, imagine we both come with cups half filled. If I simply try and pour something into your cup, I may overspill or the ingredients may not mix. But if we both empty our cups and then come together, we can fill each other with knowledge. And so when I think of working with the chairs, the different departments, there's 30 years of history here. What I try and approach for my chairs, my faculty, is let's empty our cups and then let's fill them together. And I think if we do that, the collaboration piece will become not focused on whatever the past is. I think the fortunate part is, as an external person here, I'm not here to fix the past. I'm here to bring us forward. And so if we start from whatever the walls were, whatever the challenges were, open-minded, and I think we'll really have some success because the people have Melt are wonderful. So if we're open-minded, I think the opportunity for collaborating is wonderful.
I love that metaphor, by the way.
Thank you. The leadership is, people can be leaders in various ways, and I think sometimes, especially as young faculty, we don't recognize that. And I think as a department chair, part of my responsibility is to not wait for the young faculty to simply look for leadership positions or find leadership positions. It's part of my job to look at them and help them identify who are leadership, which means communicating with them on a regular basis, and starting with what is it that you want to do with your life and your career. If you want to be promoted, if you want to be a national speaking circuit, if you want to be an administrative leader, if you want to be a research leader, these are all leadership roles, but they require different cultivating, so to speak. And so part of that infrastructure is having resources to send my junior faculty to different leadership training programs, having the opportunity to work with the hospital and the School of Medicine to maybe utilize what leadership programs are within the institution and also external to the institution. I have a very strong belief that leadership should be a diverse model, as in that model, we all improve. So looking at leadership positions that are geared for women, people of color, also because how to be a leader in those things in the scope of our life and thinking from a wellness perspective really is the world we live in now.
Right.
And we have to take all those things into consideration. And being a leader doesn't mean you have to give up all of those things. And so the path is to bring them along with you, take what they want into consideration, and then develop the programs that'll help support them and teach them the key leadership aspects of them. And then put them in leadership opportunities. Create leadership opportunities. If you are, so in the emergency department, if we don't have positions of leadership for anyone to advance to, it makes it very difficult. And that's part of the goal, is to create a structure that people can see themselves advancing, and hopefully not just within the department, but within the hospital and the medical school as well.
That's great. That's how we keep people engaged and satisfied with their work. So I think that's wonderful.
Totally agree, Bill. Totally agree.
I'd like to switch gears a little bit
Okay.
and ask you where you see some of the challenges facing emergency medicine are for Stony Brook and for the whole field across the country.
So I think emergency medicine, we all suffer from it from a national perspective. Nobody will be surprised if I say boarding as one of the issues. Being able to take our patients through the whole care experience, as well as being equitable in the care we provide to all of our community, are some of the challenges that are facing in emergency medicine. This was a field that was born out of 12-hour shifts and sort of a grinded out perspective. And this generation has learned, especially post-COVID,
Especially after
Right.
COVID.
that wellness is important. And so you're starting to see a shift of that 12-hour out in the community to 10 hours, and in academics from 10 hours to 8 hours. So we're really on the precipice of redefining what emergency medicine looks like, how it can be balanced, but also how we not just think of the traditional, we are triage doctors necessarily, but really providing care in key specific areas. The stroke, cardiac, pulmonary embolism, these are all really high-risk diseases that the care for them are now beginning in the emergency department, but integrating with key partners. And so how emergency medicine grows from that standpoint, but then really showing the medical students the balance of medicine, surgery, pediatrics, obstetrics. You really get this opportunity to see all this variety of patients. While it may be chaotic, the duck underwater analogy is, yes, it's crazy, but be calm. One of my favorite analogies to my residents who will start a rotation of rounds, and I'll say, And this is what I know is dating myself. The movie Top Gun.
Oh, yes, you're dating yourself.
Yes, exactly. Thank God for the second version.
Yeah.
But if you saw it, because emergency medicine, we first think of it as cardiac arrest. It's the trauma. It's this, right? And everybody wants to be the hero. But in Top Gun, it was the person who made the least mistakes. Like, and what I want to teach them as well is, while we have this chaotic environment, be calm and try not to let the chaos create mistakes. Sometimes just not creating mistakes. Sometimes just holding the patient's hand when we know we can't do anything is a wonderful thing to do. We don't have to put chest tubes and everything for everybody. We just have to choose the right moments to make a difference in their lives.
Right. Very wise. Very wise.
Thank you.
Where do you see our opportunities are at Stony Brook for making sure that people in communities that maybe have less access to care get the care that they need? You know, we're at a public hospital, the only public hospital in Suffolk County. How do we make sure that those communities get the care that they deserve?
That's a great question. I think the way that I see it is that we have to meet the communities on their space, right? When people come to the emergency department, it's not a routine visit and it's not by choice a lot of times, right? And so in those scenarios, it's tough to engage them from that perspective. However, there's going to be a particular office that I'll be creating as well, where we will be doing things that call them like wisdom councils. And the idea behind them is we'll take key disease areas within our community that affect key populations, and we'll go out to the communities and we'll do educational initiatives, and we'll reach out from the elderly to the high school students, because lots of the things we found is that with language barriers, technology barriers, that if you reach and educate the high school students, the college students, they in turn educate their parents and their grandparents. But the first step is meeting them out on their safe space. And I think when they then are there, and when they say, I want to go to the emergency department, coming into Stony Brook will become more of a, we want to come here, we expect that we will get this kind of care because they've come to us. And that's how I feel we can approach that.
That's great. It's really flipping the traditional model of emergency medicine.
Correct.
Instead of waiting for people to come to you, going out to them. So that's terrific. In terms of looking towards what the future of emergency medicine is, how do you feel technology plays a role? Is there a place for innovation when it comes to technology?
Oh, definitely, definitely. You know, I've always believed in technology and have, and through COVID, we developed a lot of virtual aspects to care. And most people would not think the emergency department is a space for that, but it actually is a ripe opportunity for that. Emergency medicine is actually known for being a little bullish in trying or taking on new initiatives. We're one of the younger fields when you think of medicine and surgery and pediatrics. And so the evolution of AI and the evolution of decision support, the evolution of technology, these are all areas that we can enfold into emergency medicine, should enfold into emergency medicine. Everybody's heard of ChatGPT and those things, but informatics and how to make better decisions around flow to truly figure out where your components are, the bottlenecks are to improving that. Thinking of ways where in a constantly technology-driven world, how do everything from safe discharging, using technology as a means, so when we discharge them, let technology create patient-specific types of discharge instructions, not just straight discharge instructions for everybody. And this is a place where if you let technology enfold and let that generative AI in this new era of natural and machine learning languages really come into place, we're a great ground to test a lot of these things are. And I've already started meeting with some of the chairs in our computer science and biomedical engineering department to think of some innovative ways we can info some of those things. So I think emergency medicine is going to be a fun and prime breeding ground for where the generation is moving.
That's great. Usually we think of, say, precision medicine or personalized medicine as relating to such things as cancer treatment or something like that. Emergency medicine is not the first place you'd think of, so I think it's really exciting to hear you talk about your ideas for this.
Exactly. And that's the part I think I really enjoy it, is that it's not a natural place people will think about it, but we're already making collaborations, and it really, in an application process, it is a great space. And there's so many different ways we can use it to our advantage. And one of the aspects of Stony Brook is you have those schools and institutions already here.
Yeah.
All it just takes is collaborating, opening and walking in and talking and saying, you do this well, this is what we do. And if we come together, innovation bursts occur.
That's great. Maybe they'll be watching this video and they'll call you up when you see it.
I certainly hope so. I'm more than open to it.
Okay. Well, Dr. Aisiku, thank you so much for joining me this morning. And to all of our viewers, thank you for watching. I look forward to seeing you again next time for more exciting stories. And until then, keep the coffee brewing.